Case Analysis Task 1 through 5, presented by Paisley Munene. Task 1, presenting the case. A 54-year-old man presents with dizziness, a mild diffuse, non-throbbing headache, and right-sided ringing in his ear. He reports significant vertigo, affecting his balance, making walking and cycling difficult. He has a 10-year history of migraine headaches and a remote history of concussion from a high school pole vaulting injury, with post-concussion symptoms that resolve after a year. His medications include sumatriptan for migraines and ibuprofen for muscle pain and headaches. He also has seasonal rhinitis, but is not taking medication for it. He follows a low-fat, low-cholesterol diet, cycles about 50 miles per week, drinks wine occasionally, and denies smoking or drug use. He is vaccinated against COVID-19 and receives an annual flu shot. On examination, the patient appeared well and in no distress, with normal vital signs. Pulmonary, cardiovascular, and gastrointestinal exams were normal. There was mild tenderness over the LS spine, and a slight sway was observed during a neurologic exam, but all the other tests were normal. Based on the clinical picture, differential diagnoses include acoustic neuroma, labyrinthitis, Meniere's disease, metastatic brain cancer, and migraine. Audiologic testing showed moderate hearing loss in the right ear with reduced speech recognition and a tinnitus handicap inventory score of 65, grade 4. MRI with gadolinium contrast revealed a 2-centimeter mass at the internal auditory medius extending into the auditory canal without impingement on other cranial nerves or the cerebellum. Task 2, analyzing medical terms. So I chose labyrinthitis, which is an inner ear inflammation or infection. There's no prefix. The root word is labyrinth, which is inner ear, and the suffix is itis, which means inflammation or infection. I also chose ecchymosis, which is a bruise caused by blood under the skin. The prefix is ek, which is out or outside. The root word is chum, which is juice, and the suffix is osis, which is a condition or a state. And the last one I chose was musculoskeletal, which means of, relating to, or involving both musculature and skeleton. Prefix is musculo, which means muscle. Root word is skeletal, which means skeleton, and the suffix is al, which means to. Task 3, define common medical abbreviations. So I chose MRI, which is magnetic resonance imaging, is a medical imaging technique that uses a magnetic field and computer-generated radio waves to create detailed images of the organs and tissues in your body. BP is blood pressure. It refers to the force exerted by blood against the walls of the arteries as the heart pumps it through the circulatory system. Blood pressure is typically measured in millimeters of mercury, mmHg, and is expressed as two numbers, systolic and diastolic. And the third one I chose was HEENT, which stands for head, eyes, ears, nose, and throat, and refers to a standard component of the physical examination conducted by medical professionals to evaluate these areas for signs of illness, injury, or abnormalities. Task 4 is offer a differential diagnosis. So based on the clinical findings and diagnostic results, the most likely diagnosis is a right-sided acoustic neuroma. This is supported by the MRI showing a 2-centimeter mass at the internal auditory medius extending into the auditory canal, along with symptoms such as right-sided tinnitus, dizziness, unsteady gait, and absent caloric response in the right ear. The tumor appears non-cancerous, effectively ruling out metastatic brain cancer. Additionally, Vangine glioma was considered unlikely due to the absence of seizures, speech, or visual disturbances. Meniere's disease was also ruled out as the patient does not experience ear fullness or episodic vertigo, but rather persistent imbalance. This is the APA format sources that were cited, and these are the four sources that I cited here. Task 5, significance of medical terminology. So I chose a topic, why do you think a solid understanding of medical terminology is crucial in healthcare settings, not only for effective communication among healthcare professionals, but also in upholding ethical standard of patient care? My response was, a strong understanding of medical terminology is essential in healthcare, as misinterpretation can lead to serious or even fatal outcomes. Common terms used in everyday language can have very different meanings in a medical context. For example, DYS may be seen as short for dysfunctional, but in medical terms, it's a prefix meaning painful or abnormal. Similarly, STAT might be mistaken for a status update when it means immediately in clinical settings. Abbreviations are especially prone to confusion. IU, which means international units, has been misread as IV, which is intravenous. And HS can be confused with half asleep instead of half strength. D/C can mean either discharge or discontinue. This can lead to medication errors. And TIW, which means 3 times a week, is sometimes misinterpreted as 3 times a day. Without proper training in medical terminology, these misunderstandings can delay care, harm patients, or result in professional consequences. This is the end of my PowerPoint presentation, so thank you so much for your time.